Hello, my name is Abigail Walia, and today I'm doing the quiz on pregnancy growth and development. And the first question in my quiz is describe the pregnancy. Describing the pregnancy. Describing the pregnancy, including the major developmental changes. So we have the first stage is the first. They call it the first trimester. This happens in the first 2 months of the pregnancy. Your baby will develop from a ball of cells called the blastocyte to an embryo, and that will develop into your baby. And then we have the second trimester. In the second trimester, in these 2 months, the baby's sex will be visible, like to become apparent when you go to the hospital and they do an ultrasound. You'll be able to tell the sex of the baby in the second trimester, and also the secretory system will begin pumping blood, and the bones will harden. And then in the third trimester, we have from 6 to 12 months, the third trimester. There will be, this is over the last, the third trimester, it's over the last 6 to 12 weeks. Yeah. And then the pregnancy, like the baby's brain will develop billions of neurons, and his skin will fill out with the baby fat, as the baby will be preparing preparing itself to be delivered to the outside world. And then we have the second question. The second question is talking about to describe the major stages of prenatal development, including the cellular progression. So I have a drawing here which I did. So this is the cellular progression stage. In the cellular progression stage, we have 5 stages. We have the first stage, which is fertilization. When the sperm and the egg meet, it gets fertilized. That's the first stage. And then we have the second stage, which is phase cleavage, when the 2 cells begin to divide rapidly but with no growth. And then we have the third stage, which is the 16 cell, the 8 cell compacted morula, which is the stage where the solid ball is the solid ball of 16 cell. Yes. And then we have the fourth stage, which is the early blastocyte. This is on day 5. All this takes place in just 2 weeks, from the first day to about 9th or 8th day. Then the blastocyte forms, and it divides into 2. The outer layer becomes the placenta, and then the inner layer becomes the embryo. And then the last stage is the plantation. This plantation, the blastocyte embeds to the uterine lining. That's what happens in the cellular progression. And then from there, we have the embryonic period here, the embryonic period, and then we also have the fetal period. So with the embryonic period, the formation of the germ layers takes place. The organ genesis, the brain, the heart, the lymph buds, digestive system, the neurotube, which forms the brain and the spinal cord. It takes place in the embryonic period, the embryo. And then in the fetal period, this is where there's growth and maturation of the existing organs. There's maturation of the existing organs, and then the body proportion change, movement begins, and lung mature. So this is these are the stages. And then going to my next question, which is the next question, which is question 3. We are describing the major stages of postnatal development. So we have the neonatal period, which is the birth period, like from birth to 4 weeks. There is a lot of adaptation of breathing. Also circulation also changes because now the baby is born. There's a feeding reflex strong. Also, the next stage in the development is infants. Infants is between 1 to 1 year, 1 month to 1 year. Between 1 month to a year, that is infant stage. Infant stage, there's rapid brain growth, motor skill development. The baby between that period, the baby will begin to crawl, walk, and these first teeth will appear. Then we have the childhood, which is between 1 to 12 years. So in childhood, there's steady physical growth, improved coordination, reasoning starts, language, and also in this period there is the baby teeth will fall off and the secondary teeth will appear. And then we have adolescence, which is from 12 to 18 years. There's between this period, there's puberty takes place, hormonal changes, reproductive maturity. Then there's also growth sprouts. There's also emotional and cognitive development. And then we have adulthood. In adulthood, it's a stage from adolescence to old age. And then the person in adulthood remains relatively unchanged. And we have degenerative changes that begin to occur in adulthood. Then we have senescence, which is the age between old age and until the time we die. In this time, degenerative changes continue. They continue, like your skin will change, your everything around you will change, and usually it just results to death. And everything changes in your body. There's a disturbance in the cardiovascular system, or maybe because of disease, and eventually you die. And then the next question, which is the fourth question, it's talking about compare and contrast C-section and vaginal delivery. So for vaginal delivery, it is natural birth canal. It is the recovery after delivery is shorter, time recovery is shorter. There's a low risk of infections and respiratory problems in the baby. And also, it gives hormonal benefits for bonding and breastfeeding. It also, the baby also experiences compressions that clears lungs during natural birth delivery. And then with the C-section, the difference is that it is surgical. They have to do an operation and then take out the baby, and the delivery is not the same with a natural birth. It has to be through abdominal or uterine incisions, and then it also it can be done. The C-section is done usually because of unsafe birth of the child, like maybe the child is bleached or fetal distress, such. And then it has longer recovery time. The recovery time is longer because it's surgical, and it has high risk of infection, which can come in like bleeding and maybe future pregnancy complications. And also the baby in the surgical does not experience the lung compression, like lung clearing compression. It does not experience that. And then the similarities, we can say they both deliver a healthy newborn, and both surgical and natural birth canal requires medical monitoring, and we can safely say they are both safe depending on the circumstance of the mother delivering the child. And then we move on now to the next